Hi, how are you?
I'm good. I'm doing great. I'm very excited getting the IV therapy for the first time.
Good.
You are from Hydr8.
Yes.
And you're here at my house giving me this IV. So it's super, super convenient. What is Hydr8?
Hydr8 is a company we started in 2021 in September. It's a IV hydration company, and we're strictly mobile. We come to the people's homes, and we offer IV treatments.
What areas do you serve?
We cover from Sacramento all the way to Fresno, throughout the Highway 99, all the cities that are attached to it, basically. And then we do have a nurse that just started in Santa Clara County, so we covered that area, and we have a nurse in Mariposa as well. We're looking to grow the company, of course, and basically we're going to fill in all the missing pieces, all the missing areas that we're not covering currently, and then we're going to keep expanding from there on.
I live in San Jose in Santa Clara County, and I'm very excited that you recently expanded to this area so we could actually do this, because you yourself are a registered nurse.
Yes.
Do you have to be a registered nurse to be able to do this?
You do, especially in California. In order to do the infusions, you have to be a registered nurse. A lot of people ask if we take like LVNs or technicians that are IV certified. Unfortunately, even though they are allowed to do the IVs in California, they can't do the infusions, so therefore we only hire registered nurses.
How about medical supervision? Do you require medical supervision?
Of course. Any treatments offered, especially again in California, need to be under a supervision of a medical director, an MD or a DO or an NP. So we do have a medical director. His name is Dr. Kaliki. Him and I worked together before, and then we started the company together.
How long does a treatment take?
Our average treatments last anywhere between 20 minutes to 40 minutes. We offer 2 different bag sizes for based on individuals' preferences. So we have a ½ liter bag, which is our standard. Then we always give the client the option to upgrade to a 1 liter bag for extra hydration.
What other treatments do you offer?
We have tons of treatments. We have we call it a boost treatment, where it's more for people that want like for health promotion or just kind of a energy booster. It's also known as a Myers cocktail. We offer the immunity booster. We offer IVs for like that help with weight loss. We offer IVs for beauty and detox, and we also do iron treatments or iron infusions and NAD treatments as well. We do all kinds of injections, so pretty much almost all the vitamins that we offer in our IVs, we also offer in injection form. So, for example, B12, B complex, glutathione injections, lipostat injections, which is part of the weight loss package that I mentioned earlier. We offer Kenalog injections for those who overall they're generally healthy and they don't have medical conditions that are contraindicated. Kenalog is a shot that we offer for people for seasonal allergies. So people that suffer from seasonal allergies really benefit from it. It's usually 1 shot for the entire year.
What kind of payments do you take? Do you take insurance?
Unfortunately, we don't take insurance. We do, however, take HSA or FSA, so health spending account or a flexible spending account. We do accept that. As far as payments, we're very flexible. We can do cash, credit card, Venmo, Zelle, or Apple Pay at this time. The only form of payment that we do not accept is checks.
Okay. Do you need a prescription to get a IV from your company?
Right, that's a good question. So it works like a standing order. Well, that's how we describe it. So these treatments are pre-approved by the physician for anybody that passes the medical screening that we provide before doing the IV treatment. So it's not a prescription per se where each individual needs to get a specific prescription, but we medically screen every client that comes to us for certain medical conditions that are contraindicated. And as long as they don't have any contraindications or any reason that we would not be able to do the infusion for, then they are clear to take to have the infusions done.
Okay. How often do you recommend getting an IV hydration treatment?
That's a great question also. So it honestly varies from person to person. A lot of people have different opinions on this. We tend to be very laid back and very open with this, and we allow the client, the customer, to decide for themselves. We do make recommendations on individual basis. For example, for yourself, you're a healthy individual. My answer to you would not be the same as somebody, for example, that's suffering from cancer or if they've had a gastric bypass and they require fluids more often in vitamin treatments. So for those reasons, it's really hard to answer that question for everybody. But so we do that case by case.
Is this IV hydration therapy safe for everyone?
Most people, yes. We do have certain criteria that we have to meet, such as people on dialysis or people who have congestive heart failure or any other form of fluid restriction for any reason. Those patients or clients we do not engage with because they need to be under close supervision while we do these IVs, and we need to do a close fluid calculation so we don't overload them. The other clients that we don't generally do are pediatrics. So anybody under the age of, I would say, under the age of 13 or so, we don't do just because fluids are a lot of times based on body weight. So if they're generally under 100 pounds or so, we don't deal with them either, just because we don't want to overload them. Lastly, I know a lot of people always ask us about if they're pregnant or breastfeeding. About half of our treatments are totally safe for pregnant breastfeeding individuals. And the other treatments, I wouldn't say that they're unsafe. Rather, I would say that there's no data on it. There's no studies done on pregnant people on a lot of these vitamins or supplements that we offer. So for that reason, we don't offer it just to be safe. We never want to do any harm.
Okay. What is the best way for your future clients to get in touch with you?
They can always call us at our phone number at the business line, or they can message us on Facebook or Instagram. Or they can go onto the website, of course.
Thank you very much. Best of luck to you. And I'm very, very excited. And this would not be my first and last time.
Thank you. I hope you enjoy. I hope you benefit from it.
Definitely, definitely. And it's easier than thought. And it's going really smoothly. And I'm loving it. Excited.
Did it hurt?
Not at all. And I'm scared of needles and IVs. And this was totally fine.
Perfect.
It went really well.